I'm Marcus Cheeks, one of the staff members here with the association, the National ESEA Association of Federal blah, 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 long name. But we are glad you're here. Hopefully your conference has been going really well today, and we're here to introduce our speakers for this afternoon's session. It's the whole child through the lens of healthy equity. Our speakers are Jess Lawrence and Jamie Sparks. Both of them come with experience. Jess Lawrence, Jess, is that right? Jess Lawrence started a career teaching 7th grade health education in 2003. Jess was hired as the health education curriculum specialist for the Oregon Department of Education. In 2006, Jess pursued a career as a national school health consultant. She writes health education curriculum, facilitates and trains educators on school health issues, and presents at conferences. Jamie Sparks began his career as an elementary health and PE teacher in 2001. In 2010, he began as a physical education and physical activity, nutrition, and tobacco consultant at the Kentucky Department of Education. In March of 2011, he assumed the role of project director for the Coordinated School Health Initiative that was funded by the federal grant through the CDC. Currently, Jamie is the school health program manager for ETR. So will you help me welcome them to this particular session, and hope you enjoy their information and look forward to sharing with you this afternoon.
Good afternoon. How's everyone? Despite what my tag says, I'm not from California, in case you couldn't tell by my non-California accent. So I was going to start with a joke because Jess's tag does say Kentucky, and she's not actually from Kentucky. But since it is close to Valentine's, I will let you all know this is a love story. We met at a conference about 8 years ago, and both in school health background. She didn't know that was coming, so there you go. But it's awesome to be here with you, and this is a conversation that's really, really important about what's happening across the country. And so we want to have a little fun with you today. It is after lunch. You did hear PE in my background, so you will know that I'm a big believer in kinesthetic learning as well. So we'll have a little fun with getting you up and moving around and having a good time. Now, I was afraid of giving out a prize. I was afraid I might violate a rule. So we are going to do a little competition today, though. And so while I can't formally maybe give you a prize here, if I see you at the bar later, I may buy you a drink or something if you really show up here in some of our activities, all right? So that'll be the prize that you can use, or the Starbucks or wherever you may be. Do you guys like to have fun? Because I will tell you that Jess was a little worried because, I'm doing a lot of PE and health workshops, and she said, Jamie, they may not find your stuff as fun, so you got to calm it down just a little bit. So I'm bringing you the reduced version of this, so we won't get too crazy this morning, but we will have a little fun, okay? So let's get started, and let's discuss a little bit around the issue of whole child through the lens of health equity. Let's see. There we go. As mentioned, my background was with the Department of Ed in Kentucky for over close to 10 years. In January last year, I actually started working for ETR. We're Education, Training, Research. We're a nonprofit based out of California, but we work across the country with healthier schools, health curriculum. We have research scientists, dissemination, evaluation, all a part of our nonprofit mission. But our mission is advancing health equity. So on the table, you do have a copy of our printout of our health equity framework. So as we talk about that bigger picture around health equity, the inverse of health equity is what? Health inequity. So as we look at education, and we look at education accountability, and we look at all those factors, that's where we want to take a step back and talk about, if we're going to move forward with health equity, we have to understand and have a good understanding of what has created health inequity in our schools and our education outcomes. And so, and we, I think in my work, that's been one of the most frustrating things of being a health and PE teacher for 20 years. I've never had a principal or superintendent say, health and academics aren't connected. But yet, over time and time again, when I look at policies, practices, and programs in schools, we know healthy kids learn better, but yet time and time again, we fail kids in policies, programs, and practices. And so we'll take a look at why those things have happened. So let's start with a quiz. Would everybody agree this is 2020? This is 2020, right? We are in the year 2020. That's pretty cool. 2020 vision for us to move forward with our work. And so normally this is the part of the presentation where I would slip behind the screen and I would slide into my dark brown costume from Back to the Future, and I would come out in my crazy costume. But Jess said you guys weren't fun enough for that, so she made me keep the costume at home. What do you guys think about Jess right now, huh? They're disappointed, Jess, I told you. But anyway, so we used to go back to the future and look at some things. So let's all stand up, because if you think it's 2020 now, what's important is we want to go back here to 1965. Anybody around in 1965? All right. In 1965, why is that important for us to talk about health equity? I told you guys you're going to have a little fun. How many Jimmy Fallon fans in the house? Any Jimmy Fallon fans? Okay. Everybody like lip sync battles? All right. Here's your chance. So in my dark brown costume that Jess made me keep at home, we're going back to 1965. But if we want to make sure that we're in 1965, we're going to do a little lip sync battle here. All right. So this is where I'm going to give out some prizes possibly for the best performance here. So let's make sure that we're in 1965.
Now let's meet the #1 singing trio in the country today, with the song that brought them to the top of the record field.
Come out of your shell.
Good-looking youngsters with long
Jess
hair
is
on
quite
them
the
that look
performer,
smooth
so.
because they're girls. The Supremes.
Uh-oh, I got some competition. There we go. Don't be shy now. We're all in this together. It's just going to be on video forever. It's okay. 1965, why is that important? As you know, that's when we start the Elementary and Secondary Education Act. So ESEA. So we have all these different iterations of the ESEA that we're going to go back through and look at. But the interesting thing I found when I started looking at the health equity part of this, right, this was done for the right reasons. It was in impoverished area, Title I funding, low socioeconomics, knowing that the federal government had to help out schools and local communities. And so that's where we see the first part of funding in 1965. So then we fast forward all the way up to 1981. 81, where are we at 1981? Huh? All right, 1981. In 1981, so look at this. We leave it alone, 1965 all the way up to 1981. But as we go through this reauthorization, all of a sudden we see the first time this presidential influence, right? If we're going to give schools money, we want something back in return. So we're going to start to see that pressure engage in just a little bit. 1981, let's make sure we're there.
Jesse is a friend.
Who wants a drink tonight?
Yeah, I know he's been a good friend of mine. But lately
This is right up Jess's speed right here. Come on, Jess, don't hold back now. They're kind of mad at you because you took my costume. 1981. Not only is Jesse's Girl the top hit in 1981, but all of a sudden we see the push for educational excellence, and that happens in 1981. So now all of a sudden, as I said, we're starting to put pressure on schools. We're starting to look at accountability, and then that brings out 1989.
If I could turn back time, if I could
Any Cher fans in the house?
find a way, I'd take back those words that hurt you.
I got to remember I'm mic'd up. You don't want to hear me sing. The rise of standards-based reform. So all of a sudden, 1989, we see the rise of the standards-based reform. This is the first Bush administration, and looking at accountability around 1989 around standards-based reform. So all of a sudden, we're starting to solidify some things. That's where we're starting to go into this testing mechanism, and that brings us up to 1993.
Party people!
1993. So look how quickly we start more and more often putting our fingers in education, what's happening in education. In 2001, that takes us all the way up to 2001. And then in 2001, how many big music people are in the house today? Anybody like big music fans? 2001, music people? Where you at, music people? Music fans? All right. What you may not know, you may have heard of these other bands, but in 2001, this is when the world's greatest band is performing in 2001. You guys ready for the greatest band of all time in 2001?
Never made it as a wise man. I couldn't care
Don't lie.
for
If you're a Nickelback fan, come on now. Nickelback, greatest band ever, right? No. See, it's one of those things you publicly admit it, and then people are like, you're really, I'm really a Nickelback fan. But thank you all for not being Nickelback fans. I was waiting to see somebody come out of their shell. There's usually one Nickelback fan in the crowd. In 2001, we have a test-based accountability. So you guys are all familiar with this. But look at what we're doing from 65 all the way up to 2001. What are we doing? We're gradually putting more and more pressure on schools. We're pointing the finger at schools more. When schools don't perform, whose fault is it? Teachers' fault. And now all of a sudden, No Child Left Behind comes into play, right? We've built this momentum of narrowing our focus, and all this time there's some things that are happening around health and equity, but also arts and humanities and other areas. That takes us up to 2009.
I got a feeling that tonight's gonna be a good night.
All right, you may have a seat. In 2009, competitive grants, federal prescriptions become a part of the educational progress. So as we look back from 2020 all the way back to 1965, there's things that are happening in education. And the interesting thing is, as a person that comes from the school health background, I spent a lot of my time working under and for and through Centers for Disease Control grants. CDC has been a tremendous asset for the world of school health and health equity, of saying if kids aren't healthy, if kids are not hurting, if kids are not hungry, they're going to perform better in school. But yet, when you look back at this system, do you get any credit for doing what's right for kids? You don't. That's what we have. In this world of superintendents and principals around health and wellness and promoting health equity, we get champions, but we don't get consistency because there's a lot of that system that works against doing all of those things. And the other interesting thing was, this happened in 1987. I'm going to let Jess introduce this concept, but it's important to look back and see all the forces. So this year in 1987 was very pivotal because it actually happened right down the street at the Centers for Disease Control, 1987. So Jess, take us through 1987.
Yeah, so in 1987, a few folks at Centers for Disease Control and Prevention said, you know, we have some great educators. We could have the best school nurse in the country, but it doesn't necessarily mean that this district or school is the healthiest school or the healthiest district. We could have the best health teacher or PE teacher in the world, and it doesn't necessarily mean that this school or this district is a healthy school and district holistically. So they created what we called at that point the coordinated school health model, and some of you might be familiar with that term or that model. It was an 8-component framework that Diane Allensworth and Lloyd Colby introduced. And over the years, Centers for Disease Control and Prevention funded states to implement coordinated school health. So when I was at Oregon Department of Education, I was funded through that grant. And Jamie was in Kentucky. So in order to demonstrate what this model and framework kind of means, we're going to do an activity. So I need 8 volunteers. You do not need to dance or sing. It's not that risky. But 8 volunteers to come up and come on over to this big space over here. So just pop on up. Don't be shy. Jamie's going to give you a little, we're going to call out Lynn. Lynn, you're going to have to do it because we know you.
All right, thank you. Oh, sorry about that.
Great. So come on over here.
Thank you so much.
And because we don't have a handheld mic, what I'm going to do is once they clip on their little name badge, I will read the role that they will be.
Oh, yes, right over there. Anybody want to be a PE teacher here? All right, thank you. This
Just
is the
stand
part
here
where
in
you
a
don't
line.
make eye contact.
You're all like, oh, I'm really busy right now. As Jamie's walking around. Didn't work for you. Well, thank you. So up here we have people that represent one of the components of the original coordinated school health model. So we have a school nurse, a human resources director that represents staff or employee wellness, a food service director, a school counselor, a custodian that represents the environment, parent, health education teacher, and a physical education teacher. So what I'm going to have you do is I'm going to have you hold the end of the caution tape and just roll it all the way down and hold the piece that's in front of you. Now, the way that this approach is standing in front of us, how is that like a school or a district? Is it easy for the PE teacher to communicate to the school nurse right now? No. So how is that like a school? Everyone's in their own silos. Maybe someone's out in a portable, right? Like my first year teaching, I was stuck in a portable. It was really lonely. Contractually, the food service director, they go into the staff meetings with the teachers? Not necessarily. So a lot of times we're siloed. So to help a student, Terry, this is Terry. Terry's having some stuff going on. So Terry is currently being bullied at school, a middle school student, not really wanting to dress down for PE because of the bullying, and just not really succeeding right now, really struggling. So how well can this system in a line help Terry if they're not communicating well? Terry's falling through the cracks. So if you could arrange yourself in a way that might help Terry a little bit more. I've done this a million times. No one gets in like a diamond shape. They all get in a circle. So what we need to do is we need to build a web. So what I'd love for you to do is so hold on to that caution tape, and I want you to pass it. And when you pass it, state one thing that the person in that role that you're representing could do so that Terry won't fall through. So we have a school nurse. So school nurse, what's one thing you could do to help Terry and the system? Okay, so maybe Terry has exercise-induced asthma, so working with the PE teacher. Great.
I could work with the parent maybe to see how I could give some tips at home to get the family a more active lifestyle.
Yeah, so working with the family, tips at home. Great, so pass that over, pass that, and hold the piece, because you want to build as much of a web as you can. Great. And you can put it around, you can build a knot.
I could communicate with anybody here about my issues, things, what my kid eats at home.
Yeah. So parent could talk to maybe food service about what to maybe make at home.
I could communicate with the human resources director because it also says staff wellness. The mindset of if your staff is feeling well and doing wellness thing for ourselves, we can better educate and help the students.
Yeah, so
In many ways.
let's figure out how we take care of our staff. And so the staff are modeling some really great health behaviors.
Got it.
What else? Who else do you want to cross to? You have some gaps, so look at where your gaps are right here.
As the human resource director, I could communicate with the PE teacher because I could see what he needs in his class.
Okay, health teacher. Yep.
I'm going to talk with the custodian just so that this kid can maybe interact with some other kids and with some other people, adults.
Great, so connecting, go ahead.
Go ahead. That's good.
Yeah, connecting with the custodian, because sometimes a student might connect with a custodian as another trusted adult in the school. Great.
Now, as a custodian, I see it all.
Yeah.
I get to see everything that's happening, and it's important for me to come in and go talk to somebody to understand, tell them that something's going on. So I'd actually go to the school counselor
Yep.
to talk to them about what was going on and see what we can do to help that child.
Right, so basically custodian sees a lot of things going on, making sure that the environment's safe and talking to the school counselor if need be. So school counselor, look at where there are holes in your physical web.
Talking to the school nurse with her expertise, talking with the PE teacher on their mental wellness, but also how's that affecting his physical wellness.
Right, so the connection between the mental and physical wellness and health. So how are we doing here?
Much better.
It's better.
So it looks like we might need to get a little closer. It looks like we might need to have a couple more conversations. Let's have one or two more conversations and see if we can hold Terry up.
Because it may not just be exercise, it could be other things in the building.
Oh.
Oh, that's right. It could be definitely that I'm not cleaning enough, not using the right chemicals. I'm not using the right chemicals because they might make them sick.
Right.
So you can't do anything.
So are we creating environments that are physically healthy and not creating asthma triggers or et cetera? Great. Good lighting, seats that fit children.
Okay, so.
Or you think we're ready, team? Are we going to try?
We're going to try.
They're collaborating.
So look, I want to talk to them about if phys ed teacher, will you help with this child? Sure will. Because education, PE is so important for me. I love it. It is.
Yeah, so keep talking to the PE teacher. All right, can we do it?
Yes.
We got it. We got it. All right, good. You may put the caution tape down and take a seat. Thank you. Round of applause for our volunteers. So before Jamie continues on and I talk about the next iteration of the framework, this model really allowed schools to start to think about how a school nurse and a health teacher or PE teacher or food service could work together to collaborate, to create a web, to start working together and be more coordinated because they were and still are in many cases working in silos.
And to summarize that, the way I always like to say that, and it's so frequent in schools, from a school perspective, you can change Terry's name to any child in your building, right? And you can change Terry's issues to any of the other things. It's very simple when it comes to health equity in schools and the way we're designed. We design or we deal with by default, right? And too often times when it comes to whether it's opioids or whether it's suicide or whether it's depression or whether it's whatever the latest, greatest trend that's facing our children, more often than not, unfortunately, as simple as that model is, we're dealing with and being reactive by default rather than by design, and that's the coordinated school health model. Look, and the other thing I want to point out in that model, did we create anything that you don't, like think about the school you come from, the district you represent. Did we create anything in that model that's not already in your school? What's lacking is coordination and communication. When we look at the 8-component model of coordinated school health, the only one that's ever usually can be lower, and in recent years we're doing a much better job, is that health promotion for staff. Oftentimes we're underworked, overpaid, and what do we always leave out? Taking care of our own staff and our own well-being of those around. And I think we're starting to see more systems, more insurance companies that are investing in that. We see that happening. The corporate world does a great job of that, right? The employee wellness benefits in the corporate world, because why? Healthy employees are more productive employees. If we could just take that same mantra in education as well and looking at that. So that is the traditional coordinated school health model. But think about that. As simple as this is 1987. Schools getting any credit for doing any of those things we just mentioned? Absolutely not. Getting a lot of funding for that? CDC has funding, but guess who it goes to? State Departments of Ed, and it's seed money. It's really not whole-scale implementation money. So a lot of people would look at the coordinated school health model and say, well, why is it 2020? I'm just now hearing about this. A superintendent will look at it and say, well, I've never heard of this. Where's it been hiding at? And so the question is, did the coordinated school health model fail us? No, because there's a lot of other factors, a lot of other influences. The other interesting thing that happens, I want to take you all the way up here to this year. There's a sign missing. Don't we have a 2011? Maybe not. We left a sign in Kentucky. It's all right. In 2011, here we are in 2011. And what happens in 2011, there's an organization called ASCD. Who's familiar with ASCD? Lance's going to raise his hand back there. ASCD, you guys remember Prince? Remember when Prince became so cool that he just became like the insignia thing that he went by? ASCD, that's how I always describe ASCD to teachers. ASCD got so big and so cool. Lance, you can steal this from me. You're welcome to use it for, Lance works for ASCD. ASCD, Association Supervision Curriculum Development, principals, administrators around the world, large entity. They got so cool they just simply go by ASCD now. But the reason they started looking in 2011, guess what's happening? We're blaming schools, blaming schools, blaming schools. In 2011, they start talking to principals, administrators, and superintendents, and guess how teachers feel about teaching? It's awful, right? We're getting blamed for everything. Every ill that's wrong in society, it's our fault. From health to academics to poor performing, we're blaming teachers over and over again. We don't treat doctors and dentists that way, do we? Think about if we treated doctors and dentists the way we do teachers. Cavities are your fault. Health problems are your fault as the doctor, right? That's exactly how we treat teachers. And so ASCD started noticing this, started surveying, and they said, well, what if we measured schools differently? And that's where this concept of the whole child really started to gravitate. There's a lot of different organizations and entities that will use the term whole child, but it was really ASCD started publishing some things and bringing this to the forefront of educators' mind and education leaders and said, what if, rather than high-stakes accountability, what if rather than this 10-day test window at the end of the year, what if we started judging schools by how healthy, safe, challenged, engaged, and supported kids are? What if we got credit for doing the right thing? How awesome would that education world be, right? So that's in 2014. Well, there's a little something else missing from that, and that's actually what you have on your table in front of you. And so CDC got really smart and said, hey, ASCD, you have this whole child. We have this coordinated school health model. What if we combine forces and call it the whole school, whole community, whole child model? So they simply took that whole child tenets, put them at the center of coordinated school health, and they just tweaked a couple of those 8 coordinated school health components we talked about earlier. They separated family and community engagement and said, rather than just being one component, those are important enough to be separate components. And then in the physical, social, emotional climate, because of all the emphasis around SEL and other things that we see going on now, they separated those two. So now it's a 10-component model with the emphasis being on the importance of the community. Now, the only thing I don't like about this model, it's got a terrible acronym that confuses people. We refer to this now as the WISC model, WSCC. And so as soon as you say whisk, right, people are like thinking you're baking something. So we can work on the branding a little bit. I will readily admit that. But as far as the context and the philosophy behind the whole school, whole community, whole child, it definitely brings everything in the school environment into one place in which to work from. But guess what? This is 2014, right? We said that? What's changed in 2014 from all of this? Not much. This is still, even though this is a pretty model, it makes sense. Everything's in one place. We're having new conversations. It's still a pipe dream. It's still just a philosophy that looks good on paper because the system is still not giving you much for it. It's still not funding much. It's still not a norm of what schools are. So we still have this huge health inequity piece of that.
Can I just talk a little bit about, before he moves on, I just want to talk about my perspective on this model. This model is a framework. So you can't just give it to a school and say, here you go, good luck, right? I work with a lot of districts, bringing them through an institute process to actually work on systems change, systems thinking, systems change, to really create a culture of health in their schools and districts. So this framework to me means 2 things, and we talked a little bit about it. Collaboration, right? That was clear with our little simulation, collaboration and communication. The other piece that I just want to highlight today before Jamie moves on is consistency. So a couple stories. I taught middle school health education in North Portland in Oregon. I live in Kentucky now, as he said, but in Portland, Oregon, big bike community. So I partnered with the Bicycle Transportation Alliance, and we brought in a fleet of bikes to my health class, and we learned the rules of the road and how to wear a helmet and fix a tire, and then we'd bring everyone out on bikes, and it would be great. And I used to bike commute, and I one day forgot to wear my helmet. And I had students call me out for that, right? Because I was like the bike crazy woman, right? Like I was like doing the bike programs and teaching them. And legally I didn't have to wear a helmet because I was over 16, but I was sending an inconsistent message, right? Another example, Portland, Oregon. So it's where Nike is, Adidas is, Columbia is there, Fila used to be there. So kind of big sports brand area. And teaching 7th grade. And one day I happened to have an Adidas sock on and a Nike sock. And I had like 6 kids call me out for cross-branding. So if middle school students can call me out for cross-branding, they definitely recognize when the school community only cares about them eating breakfast during state testing week. And when PE is offered for 20 minutes a week. And when the school nurse is there on Friday afternoons only. What inconsistent messages are we sending students and staff every day about their health and well-being? It's not good. So what are the ways that we can be consistently sending healthy messages to students and staff? So what is taught in the health education classroom or the physical education classroom is consistent through policy, practices, and programs. That's what this framework means to me. Go ahead.
Great. Thanks, Jess. I told you that I'm a kinesthetic learner, so everybody stand up for me. I didn't sign a waiver on this. You don't have to stand in your chair. I'll stand in my chair. So as you think about this from 2014, the WISC model comes out, whole school, whole community, whole child. This I said it's a pipe dream, so to speak. I want you to think about the people in your school, in your district that represent this model, okay? From the nurses to the cafeteria staff to the health PE, they all contribute to that bigger goal of what you're held accountable for, which is education outcomes. But health and education outcomes are intrinsically linked together. So what does it feel like to be a PE teacher in this world? What's it feel like to be a health teacher, right? Well, here's an analogy that I've given in almost every group I've spoken to in the last 5 or 6 years. You guys ready? Let's go up. Who's from Georgia in here, right? What's the tallest? Stone Mountain, is that the tallest place in Georgia? What? Man, you could have just went with it. Oh, yeah, all right. No, what's the tallest place? All right, that's where we're going. Field trip class. Ready? Everybody walk up the hill. Here we go. Get to the top. There's a giant rock. Everybody grab a hold of that rock and push. Ready? Ready? Push that rock as hard as, I want everybody to push as hard as we possibly can, and guess what happens to that rock? That's what changing education feels like. It doesn't matter how much research I could give you from the Centers for Disease Control. We could fill up your entire library in your school district. Healthy kids learn better. There's so much research that says that. But time and time again, we fail kids because we don't do it by design. I know it works, and you know it works. You know why I know that? Because the 2 weeks during testing, we become the healthiest promoting places in all the world, don't we?
Get your 8 hours of sleep.
You're going to hold Jamie Jr. out of recess during testing? Heck no, Jamie Jr. is getting his recess during testing. Why? Because you know it makes a difference in how I perform on that test. That's one of the hardest conversations we have going on is how do we deal with the recess issue? How do we not treat it as punishment when that's one of the only things that motivate kids? That's a tough conversation for schools and districts to be having. But as we think about this, that's where you've got to be bold and courageous, and we've got to take these conversations back about doing what's best for kids. Now, that's the cool thing about this and what happens, all right? That we push that rock. That rock, here's the thing. For so long, this rock didn't move. And there's a lot of people that got burnt out doing this work because you're just a broken record, saying the same things over and over, but nothing ever changes. But luckily, what happens in 2015? The Every Student Succeeds Act. ESEA is a great step forward. Now, we didn't land on the moon and take a giant step, but it at least opened up this conversation in every state. And in Kentucky, We led one of the nation's best efforts in ESEA because we had conversations around how should we measure student success? How should we measure school success? We had over 22 town hall meetings in the state of Kentucky. Over 4,000 people contributed to our state plan around the Every Student Succeeds Act. You know what nobody said? Nobody said, let's hold schools accountable at ACT scores or more math scores or more reading scores. They talked about a lot of holistic things, okay? Now, as I said, ESEA was not an end-all, be-all, but it was a right step in the conversation because what's at the center of ESEA? Every student succeeding. And what we know is with the growth measures we have to accomplish in ESEA, if your school and district wants to do everything the way you've been doing for the last 40 years, let me tell you what you've done for that achievement gap in 40 years. Not very much, have we? Because there's a bigger conversation that's happening around what schools and how schools learn and how students learn, especially when we look at it through the lens of health equity and all of those frameworks and things. You may have a seat. So President Obama signs ESEA into law. We're 5 years into this thing. Again, there's some bright spots that we can share. Jess's company has worked on that and done ESEA plans around whole child measures. She actually took the WISC model and did an evaluation of every state plan. So the good news is if you want to know what's in your state plan and you're not sure what's out there, there's a lot of people that have been doing this work of saying, here are the nuggets. The hard thing about ESEA was what? 50 plus states and local and state education agencies were doing this thing at the same time. It was really hard for us to learn from each other because we all had to get our plans turned in and do all this feedback. So it was a step in the right direction in helping us to move from where we've been towards where we want to go, but we still got a lot more work to do. The WISC model, we'll share some resources and some things around that. I know this conversation works. I'm very fortunate to be a part of an organization called Shape America right now. I'm actually the national president. It's our health and PE organization. So SHAPE has been one of the 5 or 6 lead organizations in developing the Title IV-A coalition in Washington, D.C. So basically, if you want to know what the Title IV-A coalition is, take your school, dump it upside down, and all the associations that fall out, that's basically the Title IV coalition. The science teachers, the school counselors, all of those, because Title IV-A is a what? Well-rounded education. There's a lot of things. So that was the other key thing that happens in ESEA. All of this time, guess how much money can come from federal dollars into health and PE and school safety and school nutrition? $0, right? Until ESEA redefines core subjects to well-rounded. Now, all of a sudden, for the first time ever, we have teachers getting professional development for health and PE, coordinated school health and WISC model implementation because ESEA allows those funds to be used for those. And so that's where we want to have some more rich conversation with you about what your school, state, or district are doing around these different issues with that. So to reframe before we go into the activity, the whole child, so hopefully, right, there's 2 key things that are in our title, addressing health equity through the lens of the whole child. So we define the whole child, safe, supported, challenged, engaged, as defined by ASCD. We know that that is the core, the central part of the WISC model. The coordinated school health, all those components around there, okay? So we're going to have some conversations with you about existing work, where to pick up, where to build from. The one thing that I would recommend to you as you think about this and how to apply that we often overlook, every school district in this country that does the National School Breakfast and Lunch Program has to have a wellness policy with stakeholders engaged. That's a great place to start to take this back because you already got pockets of something going on. Oftentimes those nutrition directors that are in charge of the lunch line also have to be in charge of the nutrition education and physical education components within the school or district. So that's just one example of where this WISC model, you don't have to recreate the wheel for new things, having that foundation going within that. The other side of that is looking at this from the perspective of health equity. As a PE teacher, okay, one of the first things I usually, when I do keynotes and speaking conversations, I usually stand up in front of the audience and I start by giving a bad example of PE. And I start by saying, that's the elephant in the room, and I want to apologize to you. Because when we talk about quality PE, many of you sitting out there may have had a terrible PE experience. or a terrible health education experience. And what we tend to want to look at and do is say, well, why didn't that teacher do better? Why didn't my teacher give me a better experience? And we want to point the finger at people, okay? There was an article that came out in The Atlantic when I first started working for ETR, and the title was, PE so bad, kids are skipping school because of it. And it made a lot of people mad. I reached out to the author and I said, thank you. Thank you for saying what every audience I speak to thinks when I talk about PE or health. And so when we look at it from a health equity framework, think about this. Think about the WISC model. Think about health and PE teachers. Think about this system. Think about how many of them have been left behind by the system, right? Have never went through. How many of your when you look at your WISC model in your school or district, how many of them had to sit through reading and writing professional development, but yet that's not what their job is, right? That was the system we created. So we left a lot of teachers behind as a result. So when we look at it from an equity framework, we know the systems of power is starting to change. That's moving in our favor. We also know that opens up opportunities for professional development, relationships and networks. That can help to start to address individual factors of teachers and making them, right? Who wants to have passion about what they do if the system doesn't value your work and the outcomes in which you produce? So as we look at it from an equity framework perspective, all of these things are starting to change. That's the reason I tell people the rock is not rolling real fast down the hill, but the rock is starting to move, isn't it? We are thinking differently about education. How many of these did we call education reform? Education reform. How many times we've been doing education reform, right? But all of a sudden, these conversations that we're having with whole child and health equity, now I think we're really starting to look at what true education reform can be for what? Every student. We get pockets of students that move and succeed, but all of a sudden, if our systems were designed better, and I think that's where we want to have the conversation next.
Great. Okay, so we're going to break you up into groups. So there are table tents on the tables, and they represent the components of the WISC model. So we're going to do this as choice, not forced choice, but choice, because you're going to be more, might be more relevant. Like one of the components might be more relevant to you. So for example, there's two PE/PA ones back there. They're in blue. We're going to do two tables of each, unless there's only enough for, enough people for one table. So you can find the 10 components by, if you look at this WISC model that you have, the 10 components are in the blue. All right. So we have counseling over here in yellow. We have health education in bright pink. We have social emotional climate here. What's the lavender? Nutrition, food service, health services, so school nurses, school-based health centers. What's the gold? Physical environment, and then family engagement, community involvement, and then employee wellness. So grab your stuff. Once you move, you'll be there for the rest of the time. So let me give you the directions. So when you move to the 1 or 2 tables, say hi to people, and then we're going to give you a chart paper, and on it we're going to have you answer 2 questions. 1, what are the policies, programs, and practices that support health equity through that component? So one of my examples was for nutrition services, having breakfast, lunch, and supper programs at school creates an equitable scenario, possibly. Right? Depending on how it's implemented and rolled out, of course. Then, what policies, programs, and practices perpetuate health inequities? What impedes equity? There's a lot there. So have a conversation about that. So for example, food deserts, so areas around schools where there aren't nutrient-rich options, or breakfast is before school versus in the classroom, so there's a stigma related to it. A bullying example, or access to physical education. So I want you to think about 2 things. What do we have in place in in schools and districts that support health equity, and then what impedes progress? And then we'll just have like a really quick report out, like one example or two examples. But what we want you to do is do it through the lens of one of the components. So pick a component that kind of best resonates with you. All right, are you ready to report out? I'd love for each group to report out and, share a few of the points that you had, both what do we do well to promote health equity and what don't we do so well. And it could be that I hope that you had rich conversations about, things that you're doing well and then challenges as well, because there are some things that schools and district are doing really well, and those are things we should celebrate. Is there a group that would like to go first? And we'll give you the handheld mic, and you're welcome to hold up your poster. Of course we come to a room with all concrete walls, right? We were like, really? Luckily, I brought really big masking tape. But, as educators, we just adapt. So I don't know where these will stick. They may stick on the lovely curtain behind me. We can try. But is there a group that would like to go first? And you can at least hold it up. Physical environment or family engagement? All right, you want to go first? Who would like to speak?
I guess I will. I may have to.
All right, why don't you come up here? Great.
So we had family engagement. So those things that are going well are pluses. We have a place that the nurse works with students and families to create or to speak and discuss about their health and their wellness. And that can further go into the families to talk to them about this lovely time of year that we're in, the little sickness season of when to come to school and not, and what they should be eating. Anything else I need to add to that on there? We talked about how having family engagement, having the kids fed at school and even after school, I think it's great. Their after-school program provides free snacks as well. Because sometimes lunch, I know y'all, lunch is 10:30 sometimes. It's breakfast. So a nice little after-school snack. So when they get home, they're not having to worry about they're ravishing hungry. They can work on some things and do some things together. Home visits was a big one. That schedules are crazy. Families are not what we thought families, and they're changing every day. They're different. So going and meeting them where they are, whether that be at their home or McDonald's or somewhere out in town. And then on our inequity side, on our where we need to work, transportation, of course. Sometimes families, we have lots of events and things for students to do, families to do, but they don't have a way to get there. And so that's a big one. Our EL families, getting word out to them, and sometimes Google Translate is not your friend. It will send something in, not appropriate, but not right. And then scheduling meetings and trainings. We've tried the lunch and learns, the breakfast, getting parents and families in. And I think it's really awesome. They're at a virtual school, and they do virtual meetings with Zoom. So I thought that was neat. So it's a kind of a way to get around that. But you got to get all that set up first.
Good, thank you. I really like how you said, go to families. I remember when we were trying to engage families in North Portland at my middle school, and we decided that, we recognized, we didn't decide, we recognized that there were families with parents that were illiterate or didn't graduate themselves or were undocumented, or the only time school called was when their child was in trouble. And then we want them to come to PTO meetings on school property. So we started to hold our parent meetings and our school health advisory council meetings. We alternated at the Boys and Girls Club, Blazers Boys and Girls Club, and then every other month. And then the other month was at a faith-based church or organization, and then provided food and childcare. So, we are comfortable walking on school property, but not everyone is, so thinking about that. Thank you, Family Engagement Group. Next group. Great. Social emotional climate.
Thank you. So our table, Our table talked about social and emotional climate, and I think even this morning from the keynote speakers that we had, and if anyone saw Dr. Bone, some of these things are really starting to come to the surface, which is really important. So at our table, we talked about how schools are dealing with mental health and helping with more services. The only issue is, of course, there's never enough. So that's one area that we feel that there could be some work done. The second was about recognizing the idea of brain research and trauma, and then how practices are starting to recognize that, but continuing to align research and practice in those areas will only benefit the kids. We also talked about the importance of this can't be something added on, that it's part of the culture and the climate of the school. So when you set academic goals for your school, there should also be social and emotional learning, strategic plans that you have for the community. So we felt that there, again, practices are starting to catch up. We just need to make sure that that becomes more of a priority. And with that, the opportunity, the plus is that there's multiple opportunities to embed the SEL across the day and across the curriculum if you do it wisely. What we'd like to see or would be helpful is more practical PD in that area, so teachers do see how that could get easily embedded in principals and leaders and superintendents and boards, because it can't just rest on the shoulder of the teachers. That will not work. And also, we feel another plus is the forefront with the whole child education coming into play. And a couple barriers to that is time and money. And we'd also like to achieve greater family and community involvement through these. So it's kind of a whole, every stakeholder is involved with this goal.
Thank you. Great. Excellent. Next group. All right. This group, and then we'll have schools. So this is counseling, psychological, and social services.
And we're all afraid to talk. So, so I'm going to do it here with their help. But we kind of took it on as the whole child, the Maslow's hierarchy, so that if they are not taken care of in their life, then they're not going to be able to succeed. So we have, we kind of brainstormed about what we have in our different communities and our different schools. So there's a student assistant program, there's weekend backpacks, there's legislative funding. I come from Utah, and we just received some money last year for mental health professionals in the schools. There's where the doctors are part of, where they come in and do eye care and dentistry and that kind of thing. Feminine products for young girls, winter coats, which from Utah we need winter coats. Sharing is caring, big brothers, big sisters, junior achievement, where the social workers can cover the shots, and there's clothing vouchers. And then the barriers that we saw that are really big in this field is no insurance for health or for the mental health. And then they're low income, they're homeless, or transient. So those are the barriers we saw. Thank you.
Thank you. Good. Excellent. Thank you. Health services. We had one person in health services. Mary was fine with it.
I am not a medical professional, let me say that right up front, but I do supervise our nurses in our system, and so I thought about some things that we have, and then she helped me collaborate on some barriers as well. So, of course, having our school nurses, we are blessed to have one at every one of our schools every day of the week. So it's a unique situation. With that, providing CPR, AED, stop the bleed training for everyone within our system, including transportation and nutrition. We have partnerships with our Department of Public Health as well as the medical center in our area for flu vaccination clinics, for mental health services to be provided and so forth, dental clinics throughout the year. A lot of systems with within our state have a school-based health center in which students and staff and possibly siblings of those students that attend can receive medical, mental health, eye, and dental care, just depending on what the clinic's focus is. Of course, the employee wellness programs, interns that come to work with our nurses, that's a benefit to our students and them as students as well. And then, of course, the variety of screenings that are offered through our nurses. A few of the barriers, ratio of nurses to students. I know that in a system very close to ours, you might have a nurse that covers 3 different schools, and they're not right next to each other. So that's a barrier. Office staff distributing meds because there's no one else there to do it. Whenever you go on field trips, that's something to take into consideration as well, because then you have teachers or those personnel distributing those meds as well. And then, of course, lack of funding for professional development, specifically related to their responsibilities. So.
Great, thank you. Small but mighty group. And we have a video of it even, so. Carrollton, right?
Yes, I'm actually from Georgia.
Okay. PEPA, physical education, physical activity.
So in our group, we had representation from DC, South Carolina, as well as Michigan. And so this is sort of like a combination of all that. So we started around the good things that were happening. So having mandatory PE and PA hours. So really what it looks like in elementary grades all the way up to secondary. And then we talked about the Carnegie credits that are required. For the most part, I think we were at 1.5 to 1, and then Michigan had like a half a credit to graduate. You only need a half a credit of PE, which I think that's down here. We talked about having the right people. So when we having high quality or highly, we didn't want to say highly qualified because of, well, you know what that comes with, but having the certified people to teach PE, to teach it for a 4th grader or a 4-year-old, like what does that look like, and having the right people in place. And then we talked about the lack of certified teachers in the field. But it is important to at least have it as sort of like baseline information, like baseline data, like let's start there, right? Then we talked about the different requirements. Oh, and we talked about curriculum, like having high quality PE, PA, health curricula. But then the problem is that when you have other curricula that is required, particularly in literacy and mathematics, our high quality curriculum that is happening in PE and health kind of gets pushed to the side because folks are focused on other things. So back to the certified teacher component. If you don't have enough certified teachers, then you put into place waivers so that you can at least have an adult in the room, right? And so then that goes back to like, what are we missing? Because we don't have the right people in the right places. Non-specialists, we talked about that. Pushing aside all other subjects, so yep, we talked about that. Oh, teaching strategies. So the most appropriate tools to get kids moving so that they're not standing in line or waiting for the next thing to happen, but really good teaching strategies. And as we're talking about teaching strategies, we rarely talk about like what's happening in a PE classroom because it's like, oh, that's fun, they're just playing, and it has to be more than that. If we're really thinking about how do we increase the visibility of what's happening and the importance of it, how do we then give the teachers the tools that they need and then the accreditation so that we have more folks doing the work in the right way. Team, did I forget anything? Oh, yes, and we added this piece of, in terms of an equity, children having the appropriate clothing and shoes for when they come to PE. Like, that's a real thing, right? And you said one thing. I think that was it. And I had one other plug that, so I'm also at ASCD, as in DCPS for a number of years, but ASCD has a free assessment that every school district can take for the whole child, so you can see like where you are, because I feel like we have all these things in place, but we don't know how to get there. So it's like a free assessment, and that's what I was.
Yeah, it can
telling
help
the folks at.
guide what to do. Thank you so much, PEPA group. Yay. And as former health and PE teachers, just a quick plug on PE and health education that Jamie alluded to. It is that paradigm shift from when we were in school. You know, health education is not just sex ed and drug ed. Our standards in health education are analyzing influences, accessing information, interpersonal communication, goal setting, decision making, self-management, and advocacy. Those are the standards in health education. That's what students should be practicing in health education every day. These content areas are just so that they can apply it to practice those life skills. But we forget that because we still go back to, no, it's just sex ed or drug ed. They should be doing skills. And the same in PE, physical education. All right, we need to set up our citizens to be health and physically literate. And some teachers out there are doing an amazing job and some aren't. So we really need to work on supporting those subject areas. Just my little advocacy push right there for health and PE. All right, who else do we have? We have a few more, I think. All right. Employee wellness. This is one that's gaining momentum. Every year I go to the Oregon School Employee Wellness Conference. I think they're the only one that do a School Employee Wellness Conference every year. It is a free conference. It's in Bend, Oregon, over spring break in Oregon, and it is excellent. I highly recommend you go if you are interested in school employee wellness. Go ahead.
Okay, so health and wellness. I'm from Colorado, and they're from Georgia. And these are things that we feel like maybe not necessarily having in our schools, but things that other districts are putting in. So starting with like access to either an in-school class where you can get fitness or getting a gym membership. Our district will reimburse staff members for a gym membership. Will you show me? Okay. Healthy snacks provided. There's always snacks in the teacher's lounge, but they're usually cookies, brownies, cake, leftover donuts. So having, fruit and vegetables available. Mental health days, so taking a sick day or a vacation day and transferring it to a mental health day, and that's gaining a lot of momentum. Opportunities for advancement by providing either education grants or opportunities for teachers to go and get more education, and then the school-based health center. Some things that we still struggle with is that our paras are worked to the bone and they're not getting the breaks that they need. Our class sizes are continuing to grow. Access for counseling for employee wellness is not something that's readily available. Funding, and then finding funding or scholarships or grants that support the staff, not just the students.
Good, thank you. Excellent. All right.
I always call it, when you look at the WISC model, it's the one that has the most synergy about it, right? Because if you can get teachers to care about their own health, they're more likely to implement other policies and practices that are going to improve the health of that. I think the biggest shift we see happening across this country is the issue over pension and teacher pay. There's nothing that threatens pension and teacher pay more than what? Healthcare cost. We are the biggest employers in most counties, in most states, as education. If that's an area we don't do a better job of owning as we move forward, it's going to do nothing but threaten all other resources we have, right? Because if we're paying more out of pocket, our district's paying more out of pocket, that's a lose-lose for everybody, including all the other services that we want to help fund. So I think that's one that we have a lot of promising movement going towards.
Physical environment.
All right, we have physical environment. So some of the positive things that we had were lockers, cubbies, just organization, because like they said, class sizes, they kind of grow bigger, and organization is key just to keep everything organized and kids can move around the classroom a little easier. Flexible seating, desk sizes that are, again, age appropriate for the kids. They're not too big, too small for the kids or the areas they're sitting in. The lighting and sound, I'm a big fan of natural lighting, so if I can have the windows open, the blinds open, and have natural lighting come in, or even they have the blue light filters that will kind of filter out this fluorescent lighting. Good sound, so the kids, no matter where they're sitting, can hear what you're saying and even hear their peers talking. Cleaning, whether it be the janitors, custodians, or the kids helping pick up. If they see a clean school, then the kids are going to be more likely to kind of help keep that clean. Scheduling is big for physical environment, because if you have a big school population, your schedule is going to have to be adjusted or changed. That way you don't have this many kids in the hallway at one time, or cafeterias or recess, things like that. Open rooms, so like a STEM area. In our building now we have a big FEMA shelter, so it's just a big open tornado room like this that we can utilize to do class meetings or team building activities or STEM activities. Some of the things that would hinder us, again, classroom size. Down here we have the age of the building, so sometimes it tends like that the older the building is, the smaller the room is. Again, you have to utilize the lockers, the cubbies, the organization for that. The number of students. We are from Kansas, so ideally our board recommends 24 or less in our elementary from grades 2 and under. 3 to 5 is 27. Again, that's a board recommendation. We can go over that. West Virginia, you said 20 for kindergarten, so smaller. This year we're really lucky, and I only have 15 kids. So 25 or more there. So 20 for kindergarten, 25. So that's a lot of kids, and again, depending on the class size or the size of the classroom. Overcrowding in the halls, the restrooms, again, kind of goes with the age of the building, just depending on the size of those things. And access to playground equipment, or even just a playground. Scheduling recesses to make sure there's not, two big groups out there at once or such.
There's so much to consider with that one, and there are some schools that are using green, clean products. Products to clean the schools that are green, but so much there. Okay, last group. We're almost to the end.
Well, then we'll be quick, because I don't want to be in the way of us getting out of here. So community partnerships. So I'm from northern Utah, so it's nice to see someone else from Utah in the room. But we've got folks from West Virginia and Kansas and Mississippi, so kind of all over the U.S. So in a lot of our districts, we have a lot of good community involvement. We do have some fun runs, and I forget what agency outside of the school puts those on, but there were a few of the districts that have fun runs that come in and go across the district that are just kid involved. And in West Virginia, there's a physician group that has really partnered with the schools, and they have clinics in the schools. They run all kinds of programming, parenting classes, grandparenting classes, cooking classes, farmer markets, where families go home with healthy foods and ideas on how to prepare that food. So drug education, and then healthcare in the schools, which is awesome. We do some of that up in Ogden, where I'm from. We also have some vision and dental partners that come in and do vision screening and give children glasses and dental screenings with like a full dental clinic in school with extractions, not just flossing and cleaning, but major stuff. We have a lot of faith-based organizations in our states that help by sponsoring a school. What are your needs? The stuff and the classes, and they will organize and bring a lot of that stuff into the classroom, into the schools for students and families to be able to sometimes it's just helping ends meet and providing those basic needs. So much of this, as someone else said in the room, is just basic needs. A lot of us have really some great, robust food programs that are brought to us from partners in the community.
In Utah, we have a lot of our local food bank brings in Bridging the Gap, which gives every kid a bag of food to take home over the weekend, which is awesome, and that way it's available to all children. In West Virginia, we have breakfast in the classrooms, which sounds like a great idea, and in two different ways. So either the nutrition services brings it into the classroom and they do that while they're instructing, or they just sit and eat as community, which I think is awesome. Some of the barriers that we determined were, funding, because there's always such a greater need than any one community partner or school entity can provide, and sometimes lack of resources, and it just depends on what it is and what the need is at that moment. So it's great to partner with community. It really does help make a huge, huge difference.
Thank you. Thank you.
So as you think about, we were in the 10 components and we broke up, but some familiar theme I kept hearing through those as each group presented was these are not silos, right? How many times did you hear community about the importance of services, from psychological to school nurses? So all of those, and that's what you see in the model, is that community piece is emphasized. Couple of things to leave you with in the last few minutes. We'll do that slide.
Sure. So just briefly, here are some of the opportunities through ESEA. On my site, Cairn Guidance, we did review every single state ESEA plan through the lens of school health and whole child. That was quite the feat. We presented on it last year. But there are opportunities of how you can reframe thinking about student success. So that can start very local. So, I challenge you to say, what does student success mean for our community? Academic achievement, okay, but what else? What does it mean to be a thriving citizen? What does it mean to be an employee? What does it mean to be a thriving family member? And what can schools do to help with that success? Identifying evidence-based interventions, of course, is a component of ESEA, and evidence-based strategies to implement. And ASCD has a great assessment tool. If you're working on mental health, University of Maryland Center for School Mental Health has a great, they call it SHAPE. It's a different organization than the organization that Jamie is president of, but they do a SHAPE assessment tool, which allows schools and districts to look at kind of like the holistic view of policies, practices, and programs, but through mental health. I'm working with some counties in Ohio around that. So again, using assessment tools and evidence-based to help kind of drive where your gaps are. And then just, again, what you can do, I'm not going to read this slide. The slide is should be on the app, but it brings you through from U.S. Department of Education, kind of a call to action, what their opportunities are to support whole child, and then what state departments of education can do, helping support districts using language that talks about whole child, all the way down to schools and school districts, and really talking about what does it mean to promote the health and well-being. And I go back to that consistency piece. What are we doing to send consistent messages around the health and well-being of students and staff? And where are we inconsistent, and what can we do better? You want to talk about these?
Just a couple of resources that are there, a number of different organizations that are working in and through. We've mentioned Centers for Disease Control. We've mentioned ASCD. The National Association of Chronic Disease Directors also has a WISC guide. And then the one, what's the one over to the right there, the guide for incorporating, is that NACDD as well?
It is as well,
yep.
Yes.
So alphabet soup there, but a lot of different organizations that have started doing this. ASCD has some great highlights around schools and districts that have already started implementing this. I know that they recently have launched a whole child network as well. So again, just a lot of growing opportunities and things that are out there. So please reach out to Jess. We're both active on Twitter, so you're welcome to reach us through Twitter, through a direct message. I also have a sheet at the back that has my contact information on it with ETR. My job with them is whatever you need it to be. I literally tell people that all the time, and my job is to help schools move this bar. And every school in every district is in a very different place, and so that's the reason. It's just creating that opportunity, creating that conversation in order to move that forward. And I'll give Jess one last Normally at this part of the show, the part of the presentation is where I put on my cowboy hat and my boots, and I bring out my guitar, and I have a country song that I wrote, but you'll never guess who made me leave that at home.
You'd be really happy.
We have a national initiative with Shape America called 50 Million Strong, and it was looking at, we launched it a few years ago, 50 million school-aged children in this country, and it was between now and 2029. So I jokingly have created a country song between now and 2029. But as we leave here today, that's my challenge to you. Think about over the next 9 years, what are you doing to play your role in this part of moving this conversation forward and all the great things that can happen as a result of the opportunities we have to work and serve kids. So thank you for what you do on a daily basis. Thanks for spending the afternoon with us, and hope everybody has a great rest of the conference.
If you want to take photos of these sheets, you can. We'll leave them out just for a few more minutes, and I have my card too. But thank you so much for spending some time with us. Appreciate it.